Welcome back to the Physician Center for Beauty. John Ramsey along with Dr. Sean Maguire. And Dr. Maguire, I know this is something you feel very strongly about. A 90-day skincare program. Give me the details and really what makes it unique.
So, with spring coming up, lots of people want to get their skin in better condition. This is an intensive program to get your skin in the best condition possible based on what the problems are. So we've got 3 different packages, 3 different programs designed to treat fine lines and wrinkles, whether they're mild, moderate, or severe, acne or acne-prone skin, rosacea. And depending on what the patient needs, we tailor a package and a program for their skin to get in the best possible shape. It involves facials and chemical peels, something called IPL or intense pulsed light, and then something called gentle waves photomodulation, which is an LED light source treatment. And then the products are included in that package price. So the process starts by coming in for a skincare consultation with Marilyn Cannon, our skincare consultant. They come in and we kind of evaluate their skin. She spends about an hour with everybody. There's no charge for the initial consultation at all, and there's no obligation. So people come in and really get educated about their skin. There's a lot of confusion about skincare. And sometimes people don't know what the issues really are, and they really don't know where to start. So it starts with a skincare consultation with Marilyn, and she initially just talks to them and talks about what their goals are and what products they may be using, what treatments they may previously had. And then she does what's called a Visia Complexion Analysis, which is this machine right here. And it's a way of taking a standardized photo of the face, and it takes it in several different directions, and then it evaluates the skin on several different parameters. And if we can just look at this this screen,
okay.
It there's several different ways that you can look at the face, but in a standardized way, you can look at spots, wrinkles, texture. We look at pore size. We look at ultraviolet spots, UV spots that are not visible to the naked eye, and then something called porphyrins, which measures the activity of P. acne bacteria, which is responsible for acne. And what's neat about this is that, first of all, it's a way of doing a comparison before and after treatments or skincare products, but it also quantifies the issues. So based on this particular patient's age and skin type, we're able to actually quantify where she is. And this is actually a percentile ranking based on her age and skin type. So she's doing pretty well with spots, which is a measure of pigmentation. She's right at 24 percentile. So wrinkles, for her age and skin type, obviously she's young, but based on her age and skin type, she's at 60th percentile. And texture, pores, UV spots, and porphyrins. So this is a way of actually quantifying what the issues are. It demonstrates it in a graphic, and we can print this out for the patient. They can look at it, but we keep it in the chart, and we're using it to kind of follow their progress and show the results of our treatment. Because sometimes skincare is kind of nebulous, and there's lots of products out there, and you may not know what works well for your skin, and this is a way of really nailing that down.
Interesting. Now, when I'm looking at this, I'm thinking, Doctor, that sun would have a lot to do with as far as probably accelerating, the skin wear and tear and wrinkles, and also the pigmentation.
Oh yeah, absolutely. I mean, it's by far the most important environmental factor, and second would be cigarette smoking, obviously. So sun exposure is huge, and we all, I know people our age used to, really not wear sunscreen. We were trying to get as much sun as possible for that healthy glow, right? But now it's kind of catching up to some of us. And sun damage is really important, and then cigarette smoking, and then, of course, genetics and heredity plays a factor. And that part we can't control so much, but we can certainly do lots of things that can arrest the process and actually repair some damage.
All right. What's interesting, though, is that there really is a method here. There is a science to it. It's interesting. A Physician Center for Beauty, you're not guessing about their skin type. It's really a really complete and very thorough analysis.
Right, and it really demonstrates, where you are relative and compared to other people, of your age with the same type of skin. And so I encourage people to call for consultation. It is complimentary, and Marilyn Cannon is great, just kind of educating people about their skin, because there's a lot of confusion out there.
All right. Dr. Sean Maguire, once again, now we've got some phone calls. We're going to try to take those coming up here. So many things to talk about. The Physician Center for Beauty. Give them a call today. Lots of specials going on. Get ready for Derby. We'll